Good morning, everybody. Thank you for joining us. While you're waiting for us to get started, if you put your name in the chat, and if you're from an organization or an agency, put that in there for us so we know who's all here. Thank you. All right, I'm going to go ahead and get us started because we have a lot to present this morning. Good morning, everyone. Thank you for joining us today for the Lake and McHenry County Advocacy Collaborative. Our theme this year is Advocating Together While Apart. My name is Gretchen Knowlton. I'm the Manager of Planning and Advocacy at AgeGuide. And helping me run the meeting today is Leslie Edstrom, Director of Planning, Grants, and Program Development, and Katie Hauser, Manager of Outreach and Events. This is our agenda for today. As you can see, we have an excellent lineup for you this morning. So to help us make sure that we don't miss any of it, please put yourselves on mute. And if you have a cell phone next to you, please mute your cell phone as well during the presentation. Also, I want everyone to know that we are recording this event. And now that we're in this virtual world, if by chance you lose connection, please just go back and re-click the link you received to rejoin the meeting. And you can always call in too if you're having any audio problems, and we'll put that number in the chat for you. I want to welcome those of you who are joining us by phone as well. You won't be able to participate in the chat, but we're so glad that you're here. Ready? And next, I would like to find out who we all have here today with us. We have a number of AgeGuide staff and a few board and committee members who are on the call. So I'm going to ask everybody to go down to the bottom of your screen and locate the reaction buttons. And I'd like all those AgeGuide staff and board members to use the raise hand button so everyone can see who the AgeGuide staff are on the call. Thank you. And if you're a service provider in the community, please click the clapping hand icon down there under reactions to let us know. We appreciate you so much, and we appreciate you taking the time out to join us today. Great, lots of you, thank you. Now, if you're an older adult yourself, 65 to 165, go to the bottom of your screen and click on the heart. Great, great, and it's okay to admit that on this call. You're totally safe with us. Good, it gives us a few more hearts there. If you're an elected official from any kind of local, state, federal legislator's office, if you're a legislator or staff, please give us the thumbs up in the reactions. And we welcome you and thank you so much for being here. I'd like to acknowledge those legislators and staff who have joined us today. We're expecting State Senator Julie Morrison from District 29. State Senator Craig Wilcox from District 32 will be joining us a little bit later. We have State Representative Bob Morgan joining us today. Jessica Sewell is here from Senator Tammy Duckworth's office, and Michelle Phineas from Congresswoman Lauren Underwood, District 14, is here. We have Sarah Doobie from U.S. Representative Brad Schneider's office, and Carrie Andre from State Representative Stephen Reich's District 63. We'll be hearing from all of these special guests during the remarks portion of the agenda later. We also have a couple of other legislators, staffers who are joining us to take notes and listen in. We have Laura Schock from Congressman Sean Casten's office and Cheryl Larson, from State Senator Dave Syverson's office. Are there any other legislators or staffers that I have missed? If you wouldn't mind putting your name in the chat, that would be helpful so we know that you're here and we can acknowledge you.
Gretchen, Senator Wilcox is with us already. He's on the
Great.
screen, so.
Oh, thank you, Senator Wilcox. I'm so glad that you're able to be here. Thank you for joining us. Thank you. Excellent. And with that, I would like to introduce Marla Fransak, our Chief Executive Officer at AgeGuide Northeastern Illinois.
Great. Thank you, Gretchen, and welcome everybody to AgeGuide's Lake and McHenry Advocacy Collaborative. I'm, as Gretchen said, Marla Fransak. I'm the CEO here at AgeGuide Northeastern Illinois, and we are the area agency on aging for the counties of DuPage, Grundy, Kane, Kankakee, Kendall, Lake, McHenry, and Will counties. And as of the last U.S. Census, there were over 703,000 older adults residing in our 8-county area. But let me be clear, we're all aging, and it's really a good thing. And to Gretchen's point that she indicated, because here by 2030 in Illinois, 25% of us will be over the age of 60. And our older adults are also an increasingly diverse population of racial, ethnic minorities, and often they may be dealing with some physical and or maybe some mental health conditions, and this could even include the onset of dementia. First, I would really like to take the opportunity to go back for a moment to a year ago today. We were addressing many of the same challenges that I'm going to be talking about, but very, very differently. Our community dining sites were packed with older adults enjoying each other's company. Vans full of older adults were crisscrossing our counties, taking people to doctor's offices and shopping. And our senior centers were all abuzz with spring parties, bingo, and exercise classes, and so much more. But then in mid-March, all of our in-person programming that our older adults relied on came to an immediate halt. Our community dining sites, senior centers, all shut down, and they have yet to reopen. Many things have changed, we all changed, and we will never be the same again. So because the social distancing that we had to do to keep everybody safe, it really worsened the social isolation that we have been working so hard to address. It heightened those already existing vulnerabilities that we all know about, like access to food, medications, medical care. So to help our older adults stay safe and connected at home, our network had to reinvent our programs and services to provide creative ways for people to connect. Virtual cooking and exercise classes were springing up. We played parking lot bingo, and we made thousands of phone calls to engage our older adults. And to address technology challenges for them, we started teaching these older adults how to use Zoom, Facebook, and email. We offered internet-enabled devices through a partnership with T-Mobile to those who didn't have access to Wi-Fi. This was vital, not only to connect to family and friends, but their physicians were also starting to use telehealth for office visits. And according to a recent research study that quantified this digital isolation crisis among our older adults, of the 80% of these older adults who died of COVID in the US, it was estimated that about 40% of them were unable to access needed online resources because they lacked in-home internet. And our Black and Latino seniors were more than 2.5 to 3.5 times more likely to be offline. Next slide. Even prior to the pandemic, older adults were experiencing food insecurity. So making sure older adults received the nutrition they needed during the pandemic was a top priority for AgeGuide. Our home delivered meals programs expanded to include anyone who was over the age of 60. As you can see from this slide, our network of nutrition providers ramped up meals since last March, and we've seen an almost 60% increase in the need for meals. From March to September, the network provided a total of over 877,000 meals to almost 11,000 people. We also had to modify how we distributed meals to accommodate the new reality. Of these meals, most were delivered directly to the homes, but thousands were also picked up at designated locations, and shelf-stable meals were provided for emergency use. I want you to keep in mind, our network continued to increase services while navigating COVID-19 protocols with their staff and volunteers, many of whom themselves were in a high-risk age group. Federal and state support for these programs during COVID were a lifeline for the aging network in responding to COVID-19. And we will still need continued support to maintain our current increased capacity to provide meals to our region. Next slide. Caregivers needs increased during COVID-19 as more people were providing help for their older family members to keep them safe at home. And I'm sure many of you had taken on those roles for older family members too. We had to expand and adapt our caregiver support programs like counseling and support groups so we could help them cope with the stress and isolation of caregiving. And to further reduce burnout, we offered caregivers a tailored assessment called T-Care to pinpoint those stressors and to prevent burnout. Isolation was magnified for these family caregivers too, especially for those caring for loved ones with dementia. So to combat this, we offered virtual programs like our intergenerational music and memory, our Sounds Good choirs and memory cafes to keep their loved ones engaged and less isolated. And although incredibly impactful for these caregivers and their loved ones, there still is not enough resources for us to meet this growing demand. Next slide. And we know that our programs and services will not return to what they looked like last March. But you know what? It's okay. This experience allowed us to reinvent and expand these programs that further improve the quality of life for older adults and caregivers. The pandemic ignited a spark of change that we all thought was long overdue. And it showed us how we could do it, but we are not done yet. Our challenge now is to get our older adults vaccinated to further reduce that social isolation and food insecurity and caregiver burden. And so they can safely return to life outside their house. You know, these older adults sacrificed a year of their lives to stay safe from the virus. And unfortunately, far too many of them died from it. Getting them vaccinated is AgeGuide's top priority now, and we are coordinating efforts with our funded partners and local health departments to register older adults, provide transportation where needed, and even deliver vaccines to them in their homes if they cannot get out. So today we are asking our federal legislators to take what we've learned and to keep it going, because we are going to need additional support, because not only are we serving more people, but we need to get them all vaccinated. And in order to do this, we need to have some support to strengthen our caregivers through the through the Older Americans Act, funding for family caregiver programs. And we want to continue funding for essential services during COVID to address food insecurity and social isolation, those two big crises that we talked about here. And we need our elected officials to prioritize and support the aging community in the vaccine rollout and outreach. And lastly, for our state elected officials, we also need additional support for long-term care facilities. During COVID-19, almost 50% of the deaths occurred in long-term care facilities. The staff and residents need to be protected from the virus with more PPE, improved infectious disease control, and more frequent testing and reporting. With visitation being limited, we need to add resources that provide technology for family visits, and that would much improve the social isolation for those older adults. We ask that funding be appropriated for the Illinois Family Caregiver Act. Representative Willis introduced House Bill 293, and Senator Belt introduced Senate Bill 1766 to fund the Illinois Caregiver Act. This was an act that was passed in 2004, but has never been funded. And lastly, we again just ask our elected officials to keep prioritizing and supporting the aging community in the vaccine rollout and outreach, because that is how we will all get out of this together. Thank you.
Thank you very much, Marla. And now, give me just a minute. Going back and forth between slides is hard these days. It's not the same as when we're together in person. Our next speaker will be familiar to all of you because hers has become a household name here in Illinois. Dr. Amal Tokarz, Assistant Director at the Illinois Department of Public Health, has been a champion for older adults and vulnerable populations for many years. Dr. Tokarz has over 30 years of behavioral health experience and approximately 15 years in the public health arena. She's a certified public health administrator with expertise in community engagement, culturally competent service design, social change, research, and human services, to name just a few of her many areas of expertise. In her role at IDPH, Dr. Tokarz serves as the primary liaison to the 97 local health departments in Illinois, and she's going to share with us about the virus and the vaccine. Thank you so much for being with us today, Dr. Tokarz.
You're so welcome. Thank you so much for having me today. There are three things that I want to talk about. I want to talk a little bit about access for older adults and some of those particular challenges and overcoming those. I want to talk about 10 things that we need to all do to keep safe, and this is especially for older adults during this time where there is continued spread, and that I want to take a moment to say just a little bit about mental health. Before I start, I want to acknowledge that the leader of this organization today that has invited me, Marla, your executive director, is somebody that I have known for years to be committed to the well-being of all others. And so she continues to do so, you know, in this work, and I'm just so honored to be with you. Elders in this society do not have an easy time of it. In many societies, elders are the centerpiece of family and the centerpiece of society. And so when we say dignity, sometimes what we mean here is we are kind to seniors at the point of service. And of course, that should always be the case, to be kind and respectful. But we hope to come to a time in our own society where dignity also means that a senior will be at the centerpiece of family life and at the center of society, not on the periphery. And this being on the periphery makes it hard. We are all aging equally. We are all aging, and we will all, if we're fortunate enough, be seniors. And in fact, the younger generation will have more experience at being seniors than the older generation because the life expectancy is increasing. So it's so important that we look at ourselves as about to be seniors if we're not already seniors, because we're all aging equally. Now, I want to first start by talking about some challenges in access. Right now in Illinois, if you don't know, it's very important that you do know that our vaccine supply is relatively modest at this time. So when I'm talking with individuals that are having a difficult time finding an open spot, it generally comes down to the amount of vaccine that is in Illinois and providers waiting for more vaccine. We are told by our federal partners, and we believe this and know this to be true, that we've already started receiving a little bit more. It is more predictable for us, so it's more predictable for our partners, and we will be receiving more and more, not less and less. So access will be easier and easier. We have a wonderful infrastructure built in Illinois that is awaiting vaccine. And so this infrastructure is really all ready to receive that vaccine and to be able to provide it. Some of the areas of challenge, in addition to that area of limited supply, include that it is difficult for seniors and others who do not have a smartphone, or as Marla was stating, do not have internet to always register online. So we are encouraging providers to allow seniors to at least leave voicemail so that someone can get back to them and help them register. But I want to let you know why this electronic registration is occurring and how it is actually a benefit to not only seniors, but all people. Those of you who recall H1N1, these were sites packed in with people, high anxiety, very close to each other, which would not be safe now, a lot of consternation sometimes, and also these sites ran out of vaccine while people were in line. Just a terrible experience for people, and it created some panic. So with this electronic registration, first, we want to make sure that the people that are registering are truly in the category that they should be and are not stepping in front of line of those that are eligible, including seniors. So we want to make sure that those spots are really available for those that are eligible. So the electronic registration helps with that. It secondly helps so that there is no crowding and there is social distancing at the site, and it is safe for you to receive your vaccine. And third, perhaps most importantly, go to the site with confidence, knowing that you have your vaccine, that vaccine dosage has been reserved for you, and you don't have to worry about it being gone before you get there. So that has gone very well for people, and that is working very well. Another area that I want to let you know is that we have asked some of our private providers to begin thinking about senior hours and letting seniors know about particular senior hours that seniors can get their vaccines during that time. We know that this worked beautifully at grocery stores, and we would like to see this at some of our brick and mortar private vaccination sites as well. So more to come on that. Another area is that our local health departments have been absolutely dedicated. Many of them across Northern Illinois have done these closed points of distribution. These are sometimes called pods, and they are especially for seniors. So be sure to check with your local health department about what open or closed pods, because seniors are eligible for a closed pod for seniors or open pod. They're eligible for both. And so be sure to check with your local health department for those, because those are some of the wonderful, wonderful ways to access. Some of those places also have drive-up option, not all of them, but do check on that as well. I also want to let you know that we are in the process of speaking with some of the larger home health agencies. We are very concerned about seniors that are homebound. If you know of a home health agency as a provider that you think would like to be a provider, please get to us at IDPH and let us know. We really want to encourage home health agencies, our larger home health agents, to be providers. We know this is not a for-profit endeavor because nobody's allowed to charge for that vaccine. They can bill insurance where possible. But there is a real need there, a real need. Not all family members can get their homebound person readily to a vaccination site. Many can, but not all. And so this is another way that we can help seniors. Finally, I want to let you know that, as you know, most seniors are finding out locally about how they can access their vaccine, but also we want to give everybody, providers and all citizens, including seniors, a bird's eye view of where they can access vaccine in Illinois. So we have a website, and I'm just going to tell you slowly what it is. And for those who want a loved one to look this up for them, it's very, very easy to look at. It is called coronavirus.illinois.gov. Again, that is called coronavirus.illinois.gov. And on that website is all the detail of who is eligible. Secondly, it shows every single place that is currently a provider, not future providers. There will be even more future providers, but current providers of vaccine right now in Illinois. This does not mean they have available openings, but they all will have some. And they all do have some, but on this map, it points specifically to the exact name and address of every single provider. Again, you will want a care coordinator or a friend or a loved one, if you do not use your smartphone, to help look for those open slots. You do not register at that website, but you can see those. You can get on the provider website or call to find an opening. And this is something where it's not just as simple as when you go to that website, just clicking on, because the slots are limited. Again, do have a loved one or a friend or a care coordinator to help you if you are not confident using your smartphone for things other than a telephone call, which is very understandable. I also want to let you know that starting next week, there will also be a call line for Illinoisans who do not have smartphones. We can't have every Illinoisan calling or the lines will be taken, but starting next week, we hope to have started a call-in line at the state for those that do not have smartphones and are having difficulty getting through to their local providers. Now, we want them to be able to get through to their local providers. That is best. But this will be a backup that will be helpful to many, many people. I've talked for a very long time. I think I'm just going to skip to one item related to mental health that is very important before I go. We know that many, many Americans and many seniors have difficulty prior to the pandemic with matters of being connected to others in a way that does not cause isolation, as Marla was pointing to. And during this time of pandemic, many of us felt increased isolation. So one simple thing that is not easy, but so important that I want to mention, this is for all of us, including seniors. It is much more important for us, if we have not already discovered this, to have meaningful connections than it is for us to have many connections. And so how do we nurture meaningful connections? Sometimes a telephone call is more important than Facebook. Sometimes an old-fashioned handwritten letter, even if someone prints rather than uses cursive, is so, so important for nurturing a relationship. Sometimes a visit at a front door or going for a walk is so much better than a party. So these things that we can do to take time with each other, and all of us remember the people in our lives that are not having connections as easily, and to be and aspire the people that we always said we would be. This is the time to develop ourselves, each of us, regardless of our age, but especially for seniors and as seniors, to develop those connections. These are the things that make our life most meaningful. This is our life legacy that we give to others, is the way that we treated others. So please, please remember these things now. Finally, for all agencies that are doing care coordination, whether you're an agency that serves seniors or you're a public health department, this is your time to connect with one another. All health departments, please connect with senior providers. All senior providers, please connect with health departments and strategize on those unique gaps and those unique things that are happening in your community so that every single senior can be brought to center. I do want to open for one or two questions for me before I leave, but let me go ahead and stop talking now. I know I was supposed to leave at 10:30, but let me, if you would like, take a question or two before I go.
Thank you. If you're able to stay for a couple minutes, that would be much appreciated. Leslie, do we have some questions in the chat? Leslie, you're on mute.
Yes, there I am. Sorry, you can hear me now?
Yes.
Okay, so Courtney Hederman asks, can you share where you're looking to host senior hours?
The state is not hosting any senior hours, but we are encouraging some of our brick and mortar private site to do those. So when they do that they will be making that public. That has not yet happened, but I know that you will look forward to that, and we will as well, and it should be happening soon.
Okay, another question is, or a statement is, it is important for pharmacies willing to provide vaccines to older adults in their homes to receive the necessary governmental approval to proceed. Wondered if you wanted to comment on that at all.
Is this a pharmacy asking?
No, it's somebody from the community who's just making a statement, I believe. Mhm.
Yeah, of course. There. If a pharmacy is doing that, then they just work that out with the state if they are doing that. Absolutely.
And then one more. In Lake County, there are over 50 non-medical in-home care providers taking care of thousands of homebound seniors. Is there a way to pull them in to help?
There is a way to pull in home health agencies that have medical director and nurses that are qualified to vaccinate if they have the capacity to do so. And we just need those agencies to contact us and register, and we are very interested in engaging with them.
Okay, I don't want to take any more of your time because I know you're staying over. So
Okay. Thank you so much for having me. Thank you so much for this important work. And Marla, you get back in touch with me if you need me further. Have a beautiful day to you all now. Thanks so much.
Thank you so much, Dr. Tokars. We really appreciated that.
I appreciate you. Thank you.
Thank you. That was encouraging. I'm so glad she was able to join us today. We do have our regular agenda to continue to go through, but I have a couple of legislators who are on the line who need to get to committee meetings and have some hard stops coming up. So if it's all right, I'd like to move them up in the agenda just to make sure that we can get them in here and not miss out on hearing from them. If they could each just take like 2 to 4 minutes to share how they're addressing those priorities that Marla shared at the beginning. I'd like to introduce State Representative Bob Morgan first from District 58. Bob, thank you so much for joining us.
Thank you for the invitation, Gretchen. Thank you for everyone at AgeGuide and all of the work that you're doing. This has been just an incredible year. And as Gretchen and I have spoken recently, it just really exacerbated some of the gaps that we had in our healthcare system already, and making sure that we're getting services to those who need it most. And that is really what our office has been focused on. Bob Morgan, I'm State Representative for the 58th District. That is the southeast part of Lake County. And we have really seen so many different challenges, particularly for seniors over the last year. People that initially were having a hard time getting COVID testing. And now, of course, we've moved into the phase of making sure the most vulnerable are getting access to vaccines. I know my 96-year-old great aunt had any number of challenges trying to get access to a vaccine. And I know we've all had our loved ones struggle at this time trying to get that life-saving vaccine. So it has been really gratifying to be an elected official at this point when the needs of the community have taken such a dramatic emphasis in what we do as a legislative office and what I do as an elected official. So I'm so happy to be here with all of you. I really would love to hear any questions you have, but in particular, just wanted to make sure I was here to let you know, thank you for what you do and that we are available to help in any way that we do, in any way that we can.
Thank you so much, Representative. Were there any questions, quick questions in the chat?
There are some questions in the chat, but I'm not sure that, I think they were more specific to Dr. Tokars, but I can just ask, maybe you'll know this. Would hospice agencies be able to assist as well as they have nurses on staff? And I think they're talking about with vaccines for homebound older adults. I don't know if you have any knowledge on that, or maybe you could speak to that.
Whether hospice caregivers can be administering vaccines.
Mm-hmm.
I don't know. I do know that they are obviously working to expand the providers and healthcare professionals who are providing vaccines across the spectrum of healthcare delivery. I don't know the specifics of how they plan to handle home health. It's a great question. Happy to follow up on that for you as well and make sure we get some answers.
Yeah.
Thank you.
I think we'll follow up with Dr. Tokars on that too, because I think it's similar to what they wanted for home care agencies to do homebound. So definitely an opportunity to leverage that too.
Thanks, Mom. Thanks, Leslie. Gretchen can't hear you. I'm so sorry.
Thank you. I'm just talking away to myself here. That's times. Okay, I wanted to say thank you for your Facebook Live events and for addressing seniors and older adults on those as well. And we'll continue to keep an eye on those as you do more of those. Thank you so much for joining us.
Thank you.
Great having you. We also, I believe we still have State Senator Craig Wilcox on the call. Senator Wilcox, are you still with us?
Yes, Gretchen, I am. So thank you very much.
Excellent. Thank you for being here.
To highlight a positive, for Valentine's Day, many in our caucus had collected Valentine's Day cards for seniors who'd been isolated, and the outpouring of support from the community was just amazing. So for all of you, know that I think the communities are behind our efforts to watch out for and take care of our seniors. So that was just an amazing event that came apart. I know you've already talked about the despair over the vaccine, so I won't get too much into that. But obviously the long-term mental health of our seniors and really of all of our residents on how this pandemic has played out, I think we probably still have a lot to learn and will learn in coming months and even years on how the true effect of this isolation, just of the fear that the pandemic has created will come to fruition and probably will create additional challenges that hopefully will be set to match. I will talk about one topic that we kind of had been looking into last year, and it took a backseat with the pandemic. But for us, the fall protocols and how they may vary between nursing homes or assisted living or independent living or seniors at home. And we're doing some research to try and understand how our firefighters and our EMT and first responders, whether they have sufficient protocols, whether there's varying protocols, because we did have an issue where a fall, sorry, just a second. Where a fall had been taken and maybe there wasn't a chart look. This was an independent living and ended up in a death for internal injuries, where a look at the chart would have indicated that maybe more than just helping an individual back into bed or looking for external indications would have been required. So that's something that we're digging into as well. And if you have expertise, certainly reach out to us. But thank you for the opportunity here, and we'll stay with you as we go into additional topics in the agenda.
Excellent. I'm glad you're able to stay a little longer. Thank you so much for those comments. And did you have a question, Marla?
No, I was just going to make a comment to the senator's point that we really recognize that really falls can lead to significant declines in people, whether or not it's a substantial fall. There's the fear of falling that comes with that, the isolation that older adults feel to not feel safe to go out again once they have fallen. And so we're focusing a lot on helping people with health promotion programs that help their balance. So we do Matter, Balance, and Fit and Strong, and really helping people navigate that. And I think all of us are prone to that as well too, because we're sitting so much now that when you go from sit to stand, you know, your equilibrium changes. And so we'll be in full support of any opportunities that we have to really partner with that, because we do understand that those critical incidents that happen because of a fall can really lead to not always an immediate death in a person, but a slower decline in that person's ability to stay independent. So we applaud you for looking at that.
Absolutely. And if you recall, a couple of years ago on my way to Springfield, I had a fall and broke my elbow. So I understand what comes with the aftermath of a fall.
Yeah.
And it's definitely challenging. So look forward to keeping working on that.
A year ago, I suffered a fall and was in a boot myself. So You do. You get a close-up look at what those mobility challenges are for people once something like that significant happens. So yeah, thank you for supporting that.
Thank you, Marla.
Thank you, Senator. We will circle back to some of our other legislative staffers who are on the call towards the end of the agenda, but I would like to now introduce another AgeGuide partner, Courtney Hederman, who's the Associate State Director for Advocacy and Outreach at AARP Illinois, where she leads vaccine outreach. Thank you, Courtney.
Thank you so much for having me, and good morning to everyone. It's so nice. I know we're not in person, and I hope that will be the case next year for sure. But it's so nice that we are able to be all together in this type of space. But really, thank you so much to AgeGuide. AARP is always appreciative of our partnership together, and just so honored to be with you and to be included in this. So thank you. And a shout out certainly to all of the elected officials and staff that are on the call, and of course all the service providers and older adults too. So really just amazing that we're all together and talking about these very important issues. As you may know, AARP is a nationwide organization, and we have 1.7 million members in Illinois. And as you know, we have a lot of issues that, you know, we work on overall, and certainly probably not too surprising, the COVID and COVID vaccine work is our number one priority. So we are hoping to really essentially be a resource to older adults and to the like, to get information, factual, timely, appropriate information, so people then can make the best choice for them and then the members of their family as well. I really appreciated Dr. Tokar's presentation. She highlighted several things certainly I would have said, and I know our federal partners will probably likely talk about everything that's going on in Washington. So I'll just be very brief on a couple of things just as it relates to how AARP is looking at stuff and things that we're working on. So even as Dr. Tokar's made reference, we have several challenges just within the COVID vaccine distribution. And one I'll just say certainly, and she already referenced to this, is just supply, right? So as that gets better, how do we even then get better in making sure that those rollout distributions happen as quickly as possible. And I think one thing that she didn't really mention, but is something to take note is it relates to centralization. So that's something that's very different compared to sometimes other states. A lot of other states are doing a centralized effort, and we're kind of not like that. We're not a statewide centralized effort. And that's actually why I asked the question, wait, what are you going to do with senior hours and stuff like that? Because we don't really kind of have that centralized scenario. The counties, though, I will say, just shout out to all the counties. They're really doing a tremendous job in partnering and doing all these wonderful things, and getting people vaccinated again as quickly as possible. So I think we have some really great practices. But again, at the state level, we kind of fall short a little bit on a centralized scenario that maybe would be perhaps helpful. I would be remiss if I didn't mention long-term care, particularly, and there's been a disproportionate share of those that have passed from COVID from nursing homes and long-term care facilities. And although we have a tremendous amount of people now vaccinated at the patient and staff level in those locations, I don't think we should be satisfied with 50, 60%. We need to make sure that those numbers are perhaps higher, so we can give the best possible chance of not having what has happened in the last year. I would also indicate that there are some additional challenges as it relates to particular communities, Black and Brown. For one, they've also been disproportionately affected by COVID. We need to make sure those populations, again, have armed information. So again, they make the best decision from themselves. But we also need to make sure that we're connecting with them in messages that's going to resonate for those audiences. We have transportation issues, so we need to kind of still work on some of those issues. And then I will just be completely honest, I think we have to look at transparency. We won't know if we're super successful if we don't continue to have transparency at all levels, federal, state, and local. And I think I'm not saying that that's not happening. I'll be honest, but we need to make sure it continues, right? So we need to make sure that we, again, have all the information we can receive. So again, that we can then showcase, wow, we've really done, a Herculean effort, and we have all this to show now too. So we need to make sure that this transparency continues. I will say, just really, again, the partnerships, these are the things that have been working and have been working really well. United Center might be a great, I think, case study on centralization. There's been some hiccups along the way, but that's a good indication of some things that are working. You also have just partnerships across the state at, again, this very local level, and even in the counties and the folks that are on this call today. You guys are all working together. Just thinking about even ARP and AgeGuide, right? Like, we're having these unbelievable partnerships, and we're sharing information and doing stuff. And it's really about bringing all these entities together. It is really unbelievable. It's been a great, just a great success in this whole very crazy, year that we've lived in, about how people are working together and trying to do, everything they can to get, again, not only older adults vaccinated, but everybody in the end as well. So definitely want to just, again, shout out how great I think that partnerships scenario is working. And then lastly, some very traditional tactics are working in getting older adults vaccinated. So, obviously phone numbers and websites help, but I think that, looking at just getting information out to people, in these very traditional ways, mailings and teletown halls and, yes, social media and some other very, very grassroots type of tactics is resonating. It's getting people information. So definitely to all of you that are working on those types of things, and ARP as well, we're realizing we are having success in these very traditional tactics. And then truly lastly, just want to invite everyone, ARP is hosting a teletown hall tomorrow at 6 p.m. with Governor J.B. Pritzker and Dr. Ngozi Ezike, the Illinois Department of Public Health Director. We'll have both of those folks on. It's an hour-long call. I'll give you a telephone number, and I'll put it in the chat as well. It's a PIN list number that you can directly call into at 6 p.m. It will be streamed on our AARP Illinois Facebook page, along with the governor's page and the Department of Public Health Facebook page. So it will also be, you can stream it there as well. But that number is 866-495-1089. Again, 1-866-495-1089. So again, really welcome anybody to participate. Please feel free to share it with others too that might be interested in hearing the governor and Dr. Ezike specifically talk about the work with getting older adults vaccinated in the state. But thank you again for having me.
Thank you so much, Courtney. Any questions for Courtney? All right. We can always circle back around at the end with more questions. So if you think of questions, go ahead and put them in the chat. Our next speaker is Marla Harris, who has been with Catholic Charities in Lake County for 18 years. She's the department director for Lake County Senior Services and oversees the case management, the community care program, and adult protective services in Lake County, and nutrition services in Lake and McHenry County. Marla is a passionate advocate for older adults, and I know she and her team have been working tirelessly since this pandemic started to make sure that older adults in Lake and McHenry are supported and safe. And she's going to share her view from the front lines. So with that, I turn it over to Marla Harris.
Good morning, everyone. And as Gretchen said, I have the privilege of working with Catholic Charities in both Lake and McHenry counties. I'm going to share with you this morning a little bit about our nutrition services. I think that's a lot of what we've been talking about today. So on March 16th of 2020, nutrition services in the state of Illinois, as we knew it, changed. We received a notification that all of our congregate programming, all of our face-to-face type programming was to close indefinitely. Didn't know when it would be starting again, but we needed to stop those services immediately. And then, as Marla Franzik said earlier, all of those people in the state of Illinois, 60 and above, became eligible or identified as eligible for home delivered meals. No one thought about what this would mean to us that provide the meals, but we had to quickly shift our focus. We had to quickly figure out how are we going to do this. Example is on March 17th, we had a large, over 250 people scheduled St. Patrick's Day parade, St. Patrick's Day program in one of our congregate sites. And we had to quickly go, okay, can we change this? And we did. We changed it right directly into a containerized meal. And we created our first pickup meal site, our drive-through pickup meal site. So since then, we've done a lot of other different things. We, of course, had to create a lot of new programming, a lot of different ways of doing things. There was no way that we could, with our bandwidth at that time, do home delivered meals for every senior that was now eligible. There was just no way. So we created, in McHenry County, we created 7 pickup meal sites. In Lake County, we created 8 pickup meal sites. We were in parking lots, we were in banquet halls, we were in restaurants, we were at schools, anything, anywhere that we could partner with somebody or get a space available where we could pass out the meals. So the seniors came through, they would drive through, we would put it either in their trunk or their back seat, no contact, everybody wearing masks, but also allowed us to keep our eyes on people, which is, of course, the most important thing that any of our nutrition programming is doing for people, is keeping contact with people, keeping our eyes on them, doing that well-being type of check. We also utilized multi-meal frozen meals options. Just again, it was another way of getting meals to people who wanted, who needed them because they weren't able or no one was able to go for them to get their food. We did shelf stable meals. But the other piece that we also had to do, which was really difficult, was create a whole new pool of volunteers. As Marla said, the majority of our volunteers in our home delivered meals in our nutrition program are seniors themselves. So a lot of them, out of concern and in a sense fear for themselves, said, oh, I'm not going to deliver right now. So we put the word out, and fortunately we were able to get a very good pool of people again. So that made being able to do this a whole lot easier also. We redeployed our staff that were congregate staff into doing these kind of pickup sites and working like that. Because we didn't want to lay anybody off. That was just not something we wanted to have to do. But the other piece that we did, which we're very, very proud of, is we continue to maintain our high quality standard of meals. So that was important. Pre-COVID, we were serving 230 people in McHenry County. In May of 2020, which was just a few months, of course, after COVID started, we were serving 434 people. So we had almost a double number of people being served by our programming. In Lake County, we were serving 467 people. In May of 2020, we were at 1,325. That's huge. That's huge for us. The only way we were able to do it was a combination of all of these services that I spoke about earlier. In normal times, getting home delivered meals to people is a challenge, as we talked. There's many expenses, mileage, vehicle maintenance, food costs. Our goal is to put as many dollars as we can to the actual meal themselves, but the cost of delivering those meals and the expenses that are incurred with that continue to be a challenge for us and other nutrition providers in the region. Again, the volunteers, we're always in need of them, but COVID has really limited our ability. All of us nutrition providers in the region, I know for sure, we sit around the table now in Zoom and talk about our commitment. We are very committed to serving the people in need, but we need the funding and we need more of it in terms of being able to continue to reach this necessary population or needed population of people who aren't ready to go out yet, but still want to be able to get nutritional food for themselves. Receiving those increased dollars that we received, the CARES dollars, those things is greatly appreciated. But you have those dollars and then we have to drop back to functioning on our normal dollars, our regular dollars, is really hard because you're going from a lot of service to then having to limit service, and that's difficult for everybody. Our local cash match dollars have also kind of decreased in some areas significantly because of COVID. They aren't getting as many donations themselves, so we're not getting as many of those local dollars into our programs. All of us rely on those dollars. That's important. Without the dollars, we don't want to be faced with having to reevaluate our ability to administer the programs. We made a commitment. We want to stand by that commitment, but bottom line, we want to be able to serve the people in need. We want to be able to do that for the seniors in Lake and McHenry counties, and I know the other nutrition providers in the region. So we're just saying is that this is an important part of senior programming in the counties, but we need to be able to be consistent with it for a period of time, and that takes dollars. So, but thank you very much, and hopefully many of you have had somebody in your life benefit from this recently, from our options also in the other regions. But thank you.
Thank you so much, Marla. Appreciate that wisdom from what it's like working directly with our older adults in these communities. Now, remember, folks, if you have any questions for any of the speakers or now for the legislative staffers, please put them in the chat and we'll read them off as time allows. I wanted to start and see if Michelle Thimius from U.S. Representative Lauren Underwood's office is still here. Michelle, I know you needed to go right away, so I was going to see if we could get you on at this point.
I am still here. Yes.
Oh, good. Thank you, Michelle.
Yes. Thank you for letting me speak quickly here. I have another call that starts at 11, so I'll just be a few minutes late. But I did want to give an update on what's going on in Congress, and I know a couple of my colleagues are here too as well, and I'm sure they'll have plenty to update on as well. My name is Michelle Thimius, and I'm the Congresswoman Lauren Underwood's district director. The Congresswoman wishes she could be here today, but she's actually on a flight back to Washington, D.C. right now. The House has a very busy week this week. You know, some of the big items for consideration is stronger Child Abuse and Prevention Treatment Act, which they're voting on today. And then later this week, the American Rescue Plan, which is the big relief bill that the House actually already passed, but now it's coming back to the House after some changes in the Senate. The bill, you know, quite simply puts shots in arms, children in school safely, and people in jobs and money in pockets. So there's another round of economic impact payments, an extension of unemployment, and a national vaccine plan and more support for local vaccine distribution, scaling up testing and tracing as well, because we know that'll be incredibly important till the very end of this pandemic. And the bill also includes two of Congresswoman Lauren Underwood's bills. The first is the Health Force and Resilient and Jobs to Fight COVID-19 Act, which would invest billions in public health infrastructure to recruit and train additional public health employees who are, you know, really just leading this fight and doing an excellent job, and just need more support. And then also the Healthcare Affordability Act, which expands marketplace premium credits for people who buy their healthcare in the marketplace. This legislation also includes some really critical Older Americans Act funding for meal delivery programs, for caregiver support, for ombudsman's programs, and vaccine outreach and coordination. So, you know, we heard on the call all of the really incredible work that, you know, so many service providers have been doing to support people and through this time. And, you know, this bill would provide some additional support for those services. The last thing I wanted to mention is that Medicare general enrollment is happening now through the end of March. And recently the Congresswoman hosted a little Q&A session with a SHIP counselor, so the health insurance counselors with the state, where she asked some of the questions that we've been receiving, because, you know, there's a lot going on and it's kind of hard to all keep up with. So I would encourage folks to check out that video on the Congresswoman's Facebook. our office is always available. If constituents have any questions, feel free to give us a call. We'll do our best to, find you answers or direct you to the people who can get you answers. Our phone number is 630-549-2190. Thank you.
Thank you so much, Michelle. And we will put that phone number in the chat in just a moment too, in case anyone needs to contact Underwood's office. There was one question in the chat asking about specifically assisted living communities, which are really struggling to survive right now because of the COVID pandemic. And this person is wondering why Congress failed to provide any funds to help rescue assisted living communities in the rescue package passed over the weekend. Do you know anything about that?
I'm not sure specifically pertaining to assisted living facilities. I do know there was an increased, additional funds to the PPP funds, which have been really critical for, businesses across the country. So, maybe Rick, I can connect with you to follow up to see if there's anything in the package that might be helpful.
Appreciate it. Thank you so much, Michelle. We appreciate your time and your advocacy. And next, I would like to ask Jessica Sewell from U.S. Senator Tammy Duckworth's office. Jessica, are you still available to say a few words? Excellent.
Yeah.
Hi, Jessica.
Hey, Gretchen, and hey, Marla. Leslie, thank you all so much for having me on this morning, and thank you everyone that is still on the line. I don't want to repeat too many of the things that were just said from Congresswoman Underwood's office, but I am Jessica Sewell. I'm the Senator's Health Outreach Coordinator in our Chicago office, so please keep me in mind as a resource for you all here, especially in the Northeastern Illinois region. Specifically, I really wanted to highlight the OAA funding for the Older Americans Act that was included in the Senate package that passed this past weekend, which is a $1.4 billion amount, as well as specific targeted funding for vaccine relief as well as nutrition services. And this is something that the Senator led with her Senate colleagues and leading for to be included in the next COVID relief package. So I just really wanted to thank you all for the work that our area agencies on aging are doing locally, especially as Courtney mentioned, we have such a decentralized process of vaccine outreach here in Illinois right now that your work is so important in reaching our hard to reach communities and specifically our seniors. So I really wanted to highlight that piece of funding. Additionally, Illinois is set to receive approximately $275 million in vaccine distribution, additional $1.5 billion in testing and public health money for our Illinois health departments, so we can really support that localized effort. Additionally, I know that mental health and substance abuse and treatment was also mentioned earlier, so there's another pot of about $100 million in there as well. There's a lot in the bill. So another highlight is just the state and local funding that we were able to secure for Illinois. That's about $13.2 billion for the state and our local municipalities. And then also really specifically wanted to highlight this was the 15% increase to SNAP benefits, as well as the extension of pandemic EBT feeding programs, which will help support our most at-risk populations. So I'm happy to share any other resources that I have, and I'll send something over to Gretchen shortly to share with the rest of you all. But please know that our office is here as a resource, and I'm happy to connect with you individually and answer any questions and provide any more updates we have. But we do anticipate this big package to go over to the House now and hopefully be signed later this week. But thank you again for your advocacy, and please know that I am here to be a resource for you all. Thank you.
Thank you so much, Jessica. We appreciate your partnership and advocacy with us as well. And now I'd like to welcome Sarah Doobie. Sarah has joined us today from U.S. Representative Brad Schneider's office. Thank you, Sarah.
Hi, everyone. And if you hear my fish tank in the background, I'm sorry. Good morning, everybody. Again, thank you for the invitation. Again, my name is Sarah Doobie. I'm one of the caseworkers with Congressman Brad Schneider's office. We represent the Illinois 10th District, so a good portion of Lake County and Northern Cook County. And the Congressman for this new Congress sits on the Ways and Means Committee along with the Foreign Affairs Committee. And I think like Michelle's boss, my boss is also traveling in the air right now. Unfortunately, he couldn't make it today. I think a lot of my federal counterparts kind of already highlighted a lot of the legislation that has been happening right now. So I don't want to take up too much more of anyone's time, but you know, like Jessica mentioned, hopefully the bill will be passed later this week and signed into law. And like others have said, if our office can be of any assistance to your constituents, you know, please let us know. Social Security, Medicare, you know, we have the VA North Chicago in our district. So if people have questions or concerns, please let us know as best we can, and I'll put my information in the chat. So thank you so much. If people have other questions, I'm happy to follow up afterwards. So thank you.
Thank you so much, Sarah. Really appreciate that. Just checking to see if we have had any other legislators or legislative staff join the call that I missed. I think I've got everybody, but if I missed you, this is your chance to chime in. Thank you so much to all of those of you who have been able to join us today. All right, it looks like we got everybody for that. I would also like to encourage all of you who joined the call today to check out AgeGuide's website and sign up for our newsletters if you don't already receive them. They're full of lots of useful information. We post resources and tools on Facebook, on Twitter, and you can follow us. You can sign up for our newsletter all on our website, which is ageguide.org, and you can find all kinds of COVID resources specifically on there. And I think that's about it. If anyone else had any questions or comments that weren't addressed, we do have a little bit of extra time, and I would welcome any comments or questions that you have. Feel free to either put those in the chat and we'll check that, or you can unmute yourself and ask a question. Okay. Excellent. All right. Well, with that, I thank you all so much for joining us today, and have a great afternoon.
Thank you.
Thank you. Goodbye.
Thank you, everybody.
Bye,
Stay
everyone.
well. Hey, Courtney, can you stay on for one moment? Okay.
You got it.
So I just wanted to fill in Leslie and Gretchen on our call that we had on Friday.
Yeah, maybe you want to stop recording
Yes, I will do
in
that.
case you want to share it with others. Yeah. Sorry.